Hello, I'm Dr. Syed Umar. I'm a psychiatrist. I'm attached to an institute called PhD Institute of Medical Science and Research, Coimbatore. We will discuss in the next few minutes an important topic. It's about alcohol. Everybody would have heard about this, is it? When we hear alcohol, we think it is just pleasure. Nothing great about taking alcohol. Everybody takes, is it? So why should we know about alcohol? It's just like tea or coffee, but it's not like that. Alcohol can kill a person. It can kill a person slowly and slowly. It's not like any lethal liquid. This is a liquid which can affect not only a person, it can affect the whole family. So that is why we should know about this important aspect called alcohol dependence or alcohol abuse. When you use the word use, misuse, abuse, dependence, all may sound alike but all are different. Suppose if I take tea or coffee every day, suppose for some reason I don't have tea or coffee today, then I just leave it, is it? I just go carry on my work. So that is use. I am using a liquid. Misuse means I am using a substance for some other thing. Why do we take cough syrup? To prevent cough. But there are people who use this cough syrup for sleep. That is a misuse. But when I say dependence, that is much more than that. That means if that substance is not available, the person cannot tolerate. He will have what is called urge. I want that, I want that, I want that. He will have craving. That means what? He will do anything for that. He will develop lots of physical symptoms. He will develop tremors. He will not sleep. He wants that. That is called craving. Now, when a person starts using alcohol, usually he starts very less. It's called small, large, cutting, 1 quarter, 2 quarter, 3 quarter, 1 full. It will go step by step by step. Initially, for a person who's alcohol dependent, small amount of alcohol is enough. We see in parties, is it? We hear from parties. In abroad, it is a routine thing. Just a peg. I had heard people saying that taking a peg is healthy for the heart. It's a fact, but who stops from a peg? They start like that, it slowly goes up and up. So they develop tolerance. That means what? The same amount which gave him pleasure is no more giving pleasure now. Initially small is enough, 30 ml, but now that is not enough. He needs more and more and more. It is called tolerance. And when a person has got this disorder, alcohol dependence, without alcohol he cannot survive. He will have tremors, he will not sleep. In fact, he will become very angry, he will start scolding others, he will beat others, he will have pain abdomen, lots of problem will come. So that is called withdrawal. Without that, there will be lots of problem. In fact, when a person consumes alcohol more and more, sometimes if alcohol is not available, for example say lockdown, for example say Gandhi Jayanti, or a festival where alcohol is not there, or if he doesn't have money to get alcohol, he will go in for seizures. What is that? He will develop fits. Sometime without alcohol, he will not be aware of where he is. He will not be aware of who are all the people around. He will not be aware of which place he is. That is called delirium. That is a very, very dangerous condition. Sometimes he will be seeing what is called animals. He will be seeing humans when actually it is not there. Imagine you are seeing animals in front of you. Nobody else are able to see. So it's called hallucination. So likewise, if a person takes more and more an alcohol, without alcohol, there will be lots of problem. So it is called withdrawal symptom. And a person, when he takes more and more of alcohol, he wants alcohol, even though he knows alcohol will cause so many harms, so many disturbance. So even if he knows that alcohol will cause so many disturbance, he will continue to use alcohol. And then when a person continuously uses alcohol, he will want alcohol. He wants alcohol for all other things. I can sacrifice my wife, I can sacrifice my family, but what I want that liquid, I want alcohol. So this is what we call dependence. When a person has this craving, urge, tolerance, withdrawal, persistence and preference, he becomes dependent. So what is there? What happens if he becomes dependent? The problem is, alcohol is not a disease of an individual, it affects the whole family. There is a risk even the children of alcoholics may develop alcohol dependence in the future. There is a risk that children of alcoholic may develop mood disorders like depression. So there is a risk that family members can also get affected. So that is why alcohol is a very, very important topic to be discussed, and we should all be aware, because it commonly starts young age. It hits the children, it hits the adolescent and college students, immaterial of the gender. Lots of college girls, lots of school girls start using alcohol for pleasure. Nobody wants to use or start alcohol for an illness. They start like this. What is a kick in that? Can I start using? All are using, so why can't I? That is how they start. They end up in having alcohol dependence. So alcohol dependence, I think we all are aware, will cause lots of physical problem also. It's not only mental illness but physical problem also. So we should know what alcohol dependence is. Okay, is there a treatment for that? Definitely there is a treatment for that. And treatment is only if the patient wants to stop alcohol. Okay, we can't make a person to stop alcohol. The only person in the world who can stop alcohol is the patient himself. But we can help him not to restart. If you hear from a person who takes alcohol, he will stop. He will stop for say 2 weeks, 4 weeks, 6 weeks. Slowly he will again restart. So to prevent restarting or to stop restarting of alcohol, we can definitely help him. There are treatment for alcohol disorder, that is alcohol dependence. It's not to stop but to prevent restart. But for that, the first step is patient should come forward. How does the person will come forward? When he is aware that there is some person who will help him. But what will all the family members will do? They will start blaming him. They will start cursing him, telling that you are a bad person. You're nalaik, you're not useful for anything. But actually, the alcohol dependent patient knows that I am above the threshold, I am taking more, I have to stop, but there is nobody around to help. But when we tell them, see, I can understand that this is not a habit, this is an illness. That means what? If I have malaria, what I should do? I should go and get treated. So if we tell that, he may definitely accept. So first step is patient's motivation. He should be willing so that to get help from a qualified person. So the first step is patient's motivation to start treatment for alcohol dependence. So for alcohol dependence, treatment is called de-addiction. It is not to prevent some pain abdomen, prevent vomiting or to treat vomit. That's called detoxification. But here we are talking about treating a person who's got alcohol dependence. That is called de-addiction. So definitely by this de-addiction, we can treat a person who has got alcohol dependence. So first of all, what we do is we look into what are all the cues, what makes him to go and take alcohol. Having friends who take alcohol, going through a way where alcohol is available. Whenever I become very happy, whenever I become very sad, whenever I am lonely, whenever I have lots of friends with me, when I have a festival, when I have lots of money, when I am having no money, all my money has gone. So like this, lots of cues will make a person to go and increase alcohol. So we have to analyze what are all the cues the person which makes him to go and take alcohol, which can be definitely addressed in what is called de-addiction treatment. Okay, so likewise there are various steps which we can definitely help and treat a patient who has got alcohol dependence. Another important thing is alcohol dependence is, it is not only going to a doctor, getting treated and coming back. It is after that, how do the family members behave to him that will prevent him going back and restarting alcohol. So the family members should also understand how to behave. For example, a person comes home, consumes alcohol, becomes angry, just vomits. What will the family members do? They'll just clean everything, make the places soft, that is, make the place very clean. Next day, he will get up and see that everything is clean. He will go and consume alcohol the next day also. So what actually should be done? I've seen patients' family who have just videographed what he does when he takes alcohol and show it to him. So he will be aware. Say, I've done so many things when I'm consumed alcohol, I've done so many things bad. Sometimes they don't clean the floor if he vomits, they just leave like that. When he gets up, he will see that and he will know how distressing it is. So treatment is not only to the patient, it is also to involve the family members how to prevent from a person going back and restarting alcohol. So this is just a summary about alcohol use, which is a very, very common scenario. In fact, one of the commonest substance abused in the world is coffee, smoking nicotine, then comes alcohol. So common is this alcohol dependence. If we don't treat this, we are going to lose the whole family. So this is just one substance what I told, alcohol. Likewise, there are lots of other substances, especially affects the college students, especially affects even the school students. One other substance is cannabis. It's a fancy term. We think that is not available here. Take my words, it's available everywhere. That is why there is strong law coming against it. It's called NDPS Act. Cannabis is available everywhere. Make a call, you'll get cannabis. So we should be aware as a person, as a professional, we should be aware, what is this? Now this cannabis is available as a leaf commonly. How actually it is consumed is, this leaf is made as a powder, cigarette, is it? So what it is done is, in the cigarette, the nicotine is taken out and this cannabis leaf powder is mixed. It's called joint. So this is also commonly available. So if a person takes alcohol, we can find out. We can ask him to just, just breathe out. We can smell alcohol. Cannabis you can't. Cannabis, there are subtle changes. The person will become what is called little bit restless, heart rate will go up, eyes will become reddish, that's all. A person cannot find out that, the family members or the friends cannot find out that. That is why it is more dangerous. Alcohol we can easily find out. Cannabis is not like that. Sometimes cannabis will hit your brain and result in what is called delirium, as I said before. He will not be aware where he is, who are the people around and what time it is. He will be totally not aware. Sometimes cannabis will make your brain work fast. He'll become manic. He'll think a lot. He'll be very active. He'll be spending a lot. He wants to help everybody. He thinks he is the God. So that is an illness. He will spend everything he has just like that. So cannabis can really affect a person, and it is very, very common. Likewise, another substance we should be aware is what is called opioid. Very dangerous. Commonly we call it as brown sugar. Okay, now this is available as you can inject that or you can inhale that. So there are lots of methods used. It's called fixing or chasing. The problem is, if a person, nobody wants to become dependent. They just go, start with their friends, think that only once. Why not? That's how friends pull them. They hook to this habit. You know what is hook, is it? They'll just bring them inside. They start with friends. They start as a pleasure. Doesn't stop. They go on and on and on. Now this substance, what I'm talking, opioid, is very, very, very dangerous. It's so much pleasure giving, very difficult to stop. When a person consumes more and more an opioid, if he doesn't have opioid, very difficult. He will have tears from his eyes, he will have secretion from his nose, he will have more saliva, he will have more diarrhea. That means he will pass stools on and on. The body will pain like that. It's like sitting, lying on the legs of the elephant. It will be so much painful body, and he'll be keeping yawning and yawning. Unless he gets back the opioid, he will do anything for that. So nobody should have that. So we should be aware. There's a substance called opioid. It is available in different form. It is available as even cough syrup has some opioid in it, codeine. Likewise, there is morphine, like heroin. Different substances are there, but we should be aware opioid is a very, very dangerous substance. One other substance that we commonly see is inhalants. There are certain substances. What usually is done, you know, balloon, is it? So what they do is they use this substance, volatile substance. They use this cream and spread over the balloon. They blow the balloon and inhale the air. So this is called inhalants. When they start using the inhalants, what will happen is the brain will shrink. So what will happen if the brain shrinks? They'll behave like a very, very, very old person. Memory will come down. So that is also very, very dangerous. So these are all the common substances. But the commonest thing that we see is what? Nicotine. Smoking. Everybody starts as a pleasure, is it? It's a style. If a college student smokes in a stylish way, that means that he has acquired some skill. It's actually not. He is going to acquire an illness. Okay, nicotine is very, very dangerous because it is commonly available. See, opioid, cannabis, you can get, but legally you can't get. But cigarette everywhere. Just come out of your house, go to a store, cigarette is available. It's written there. It is very dangerous, but nobody practices that, is it? So nicotine actually is not so dangerous, but in cigarette, it's not only nicotine. There are thousands of ingredients which are carcinogenic. Means what? It can cause cancer. Cancer attacks a person, he can die at any time. Nobody can save him. Depends on the type of cancer. So likewise, in a cigarette, it's not only nicotine. There are lots of thousands of ingredients which are very, very dangerous. One of the form of nicotine that is commonly used is Hans. Usually we hear is it Hans, Manithan, Shanti, which is equally dangerous. There are something added inside which is very, very dangerous. So we have treatment for everything. Even if a person is dependent on alcohol, cannabis, nicotine, opioid, volatile substance, definitely he can be brought back as like he was before. Only things we have to identify early, make him to come to the therapist. In fact, this unfortunately affects the productive period of life. When is our productive period of life? In our college days, is it? Then only we graduate, then only we go to a job, then only we get married. So this is the period where a person is hooked on to this substance. The whole lives become devastating. So we should definitely address this, we should definitely aware of this, and we should be knowing that there are definitely treatment for this. Maybe people who are listening to this, people who are hearing to this, your neighbors, your friends may have one of these substances. So it's high time. Take them to a psychiatrist. You are not only helping the person, you are helping the whole family. Thank you. All the best.